Turning our attention to another issue, scoliosis is often called the neglected disease, chiefly because those who have it, well, don't know they have it until it's detected by routine medical checks.
Well, the condition involves a spine that curves sideways and usually in an S or C shape like the one that you're seeing on the screen. Untreated scoliosis may lead to permanent damage of the spine and disability.
On average, this condition affects about 5% of the population. An interesting fact is that girls with scoliosis outnumber the boys 7 to 1.
Traditional methods of treatment include wearing a back brace and in severe cases surgery. But recently, a new method has come on the market and is using vibration.
Guess you'd call it good vibrations. Okay, well, here to tell us more this morning about this new method are chiropractors, Dr. Clayton Stitzel and Dr. Kalla. Good morning, guys.
Good morning. Thanks for having
us. So tell us, what are the most common symptoms for scoliosis and how serious can this condition get?
Well, scoliosis often has no symptoms, which is why it's such a neglected disease. It often affects young women, ages 12 to 14, 16, and adults can contract it, but generally is a teenage disease. But because it has no symptoms, it often goes undetected until it's very severe. The disease has a 15% mortality rate, so it will kill 15% of the people who have it.
What causes it? Why 12 to 17 of age?
We don't know. There's actually many causes, and we are unable to pin down just, one at this time. However, there are neurological and hormonal various other causes that may be involved, but we're not exactly sure.
Could you say it runs in the family?
There does seem to be a genetic link. However, we've been unable to identify a common gene.
And we're saying mainly teenagers is what you mentioned, right? Teenage girls. And again, it goes undetected for a long time, simply because I guess they don't feel it until a certain point when it gets really painful. Is that...
Often not, and that's what we see. And often by the time they're feeling symptoms, the disease has advanced to a very large, alarming degree.
Is that the same age group that you're seeing, Dr. Kalla, here in the region?
We'll see the same thing here in Asia, and that's why the Singapore government actually is doing school screenings for teenage girls here, and it's something that should be picked up by the other countries in the region to start screening for school children in the teenage years. Maybe the parents can start looking at them to see if they have any deformities, the shoulders, different heights, or any rib bulging going on in the back.
Do you think the awareness level here in this region is there or not?
It's picking up, but definitely it's higher in Singapore, but in the rest of the region it could be picked up even more.
Curious question, why is it girls more so than boys?
Again, we don't know. There's a lot of things we don't know about the disease, which is part of the problem. There's some speculation that maybe the hormonal differences, they enter puberty and things, goes into effect, and that might be part of the reason, but we really don't know.
Okay, now we're saying scoliosis is basically a curvature of the spine. So the spine is literally bent to a certain degree. So now, if we talk about treatments, there is a way to sort of straighten it, mainly using braces. Is that right?
Well, what we developed is a non-bracing, non-surgical, functional rehabilitation system of correcting the spine, where we're using their own muscles and ligaments and discs to correct their spine without the use of braces. What you're seeing in a case like this is that scoliosis, while it has lateral bending to the side, it has to be viewed three-dimensionally. And you're going to have to be able to fix the spine both from the side view as well as the front and back and up and down.
Okay, you brought in something to show us.
Yes.
This is the equipment used to fix the condition?
This is one of the pieces of equipment we use. What we've done is we've modified a power tool to actually create various vibration frequencies. And one vibration frequency it can actually relax the ligaments and discs, while the other will be used to relax the muscle spasms that are associated with it. So that allows us to prep the spine so that when we go to work with them, it makes it easier to move the spine and reposition it.
Okay, that looks pretty much just like a drill to me. I mean, I see it as a,
It's a mechanic jigsaw. It's been heavily modified.
So what you're saying, to sort of warm up the muscle, does that mean you're actually sort of kind of vibrating the back as to loosen it up?
Certain biological tissues, with discs or ligaments or muscles, all have susceptibility to various vibrations. These will make very specific vibrations that will cause those tissues to relax. As we're able to relax these tissues, then you can go in and reposition the spine and then engage a patient in a rehabilitation program that will actually strengthen and hold in that new corrected position.
Yeah, you can see that.
And that's a patient currently being treated now. How long do you have to undergo this, tool?
This particular tool is used about 7 minutes on the patient.
7 minutes a day, or how many
per
times?
treatment session.
And how often should you get a treatment session?
Probably about 3 a week for the first 5 weeks, and then twice a week for the remaining 12 weeks.
Okay, so I imagine someone with scoliosis would feel some level of pain when you're doing this, right? Because
well, actually not. They're not feeling the pain. They're actually, a lot of them are giggling or laughing.
Oh, really?
Okay. The low back.
Like
tickles the bone?
It's actually quite comfortable, yes.
Okay.
Very popular.
It's like a little massage. Can it actually cure or heal it? No. It can only ease the pain, perhaps?
No, what this does here is this actually is just one part of the tool, and we can actually cure the disease. What we have to do is you have to unlock it from its soft tissue by relaxing it, reposition it, and then have the soft tissue relock it back into place. So you can basically unlock the curved spine, reposition it, and then lock it back down again.
So what this device does is it helps you unlock it.
Correct.
Yes.
And then you will still, as a chiropractor, sort of manually work with the patient
That's correct.
to reposition it. How do you lock it back? It just...
Through a very unique system of rehabilitation. And again, that also uses a lot of vibration therapy as well to stimulate muscles to hold and contract and strengthen that new position.
Now, but the thing is, it's constantly evolving. Our muscles are growing. Doesn't that mean it may curve back in time?
There are some cases that to progress, and it can't be understated that you have to continually manage and watch the patient as they continue through their growth years.
What about your posture generally in life? Does that affect you as well?
Well, posture is the health of your spine, and what you're seeing is your posture is controlled involuntarily. So it's not something you can think about and correct. So you have to train the involuntary reflex arcs, the way you run your body here. And once you train those to run it automatically, then you don't have to worry about standing up straight because it'll do it automatically.
Is it suitable for all patients, or is it more for the milder cases and more severe cases will still have to go under the knife?
We've treated patients in the 70 to 80 degree Cobb angle range, which is extremely severe cases, very successfully.
Okay. So how long would, as you were mentioning, the whole process, let's say from the time you go in with, I don't know, an 80-degree kind of bend and to sort of get it to a decent level of 60 degrees, how long would a process like that take?
Well, it's going to vary from patient to patient. There's a lot of factors involved. If you get it from 80 degrees down to 60 degrees, that can often be accomplished easily within a 4-month treatment plan.
And what kind of advice, after the treatment, what kind of advice do you give to patients on how to take good care of your spine?
The patient is being provided with an extensive home rehab program. So
Okay.
we're
And
going
what
to
does the
What
rehab
are some
program-
examples
yeah.
of the program?
Well, we have them wear a head and shoulder and hip weighting body program. They also do some specialized spinal exercises and things of that nature, as well as lay on some certain foam blocks to help push things back into place every day. Things like that. It's a very, very minimal effort, but very effective.
And most of the patients you see, Dr. Kalla, is how effective has it been, and what's been the response from the patients?
Well, they're actually quite pleasant to use the tool, and it's helping to loosen up the spine. Now it's Clayton Stitzel here to help us to get settled up with all and get up to 100% efficiency using the tools that they're using and the method. So we're quite new to get the method in here, so he's helping us as to finalize everything. So we don't have any post cases done yet.
Okay.
So I guess it doesn't count if you sit on those massage chairs, because they also go up, right? They also...
No, I think you need to aim the right areas, and the way you do
it's
it
more
will make a
specific.
difference as well.
Okay.
Well,
There's a
thank you
right
so
wrong
much.
way. Thank you.
I've been talking to Dr. Kalla and Dr.
Clayton Stitzel on treating scoliosis using the vibration traction treatment. Now remember, this isn't an ordinary drill, so don't go take one you have at home and try it yourself. It doesn't quite work the same
No,
way.
you want to let the expert do
Yeah,
it,
that's
because
right.
touching the wrong muscles might just make you get more locked up in a sense. I don't know.
That's true.